Have you ever laughed with a friend, sneezed suddenly, or rushed to the bathroom and felt that little leak you didn't expect? If so, you are not alone. Millions of women, especially after the age of 50, experience urinary incontinence. It can feel embarrassing, frustrating, and even isolating. But here's the good news: your body has powerful ways to protect itself, and two of the most effective tools are already within your reach: Kegel exercises and yoga. Today I want to show you how they work, why they matter, and how you can begin to feel stronger, more confident, and more in control. I'm Dr. Lisa Perriera, and I've spent over 30 years helping women just like you navigate the physical changes that come with age, menopause, and life itself. On this channel, Elder Care Wellness, we bring you evidence-based practical advice to help you stay active, healthy, and empowered. If you find this topic helpful, please subscribe and share your thoughts in the comments below. I would love to hear your experiences. Let's start with the first essential idea: the role of your pelvic floor. Imagine a hammock stretched across the bottom of your pelvis. This hammock is made of muscles and connective tissue, and it supports your bladder, uterus, and bowel. When these muscles weaken, often due to childbirth, aging, or hormonal changes, you may notice leaks when you cough, sneeze, or exercise. This is what doctors call stress incontinence. The stronger and more responsive your pelvic floor, the better it can hold up these organs and keep you dry. Kegel exercises, named after Dr. Arnold Kegel, who introduced them in the 1940s, are like strength training for this hammock. Just as lifting weights builds your biceps, contracting and releasing these hidden muscles builds resilience and control. Studies published by the National Institutes of Health show that women who practice Kegels regularly can reduce leaks by up to 70%. That's a powerful return for a few minutes of daily practice. One of my patients, Maria, a 62-year-old grandmother, once told me she avoided long car rides with her family because she worried she wouldn't make it to the restroom in time. After 3 months of consistent Kegels, she proudly shared that she took her grandchildren to the zoo without a single accident. That confidence and freedom is exactly what I want for you. But here's the challenge: many women think they're doing Kegels correctly when they're not. The key is learning how to identify those muscles. Try this the next time you urinate. Pause midstream. The muscles you use to stop the flow, that's your pelvic floor. Now, don't make a habit of practicing during urination, but once you know the sensation, you can contract and release those muscles anytime, anywhere, whether you're sitting at your desk, watching TV, or lying in bed. Strengthening your pelvic floor is the first powerful step in preventing and even reversing incontinence. And when you combine Kegels with another gentle restorative practice, yoga, you can unlock even greater protection. In the next section, we'll explore how yoga complements Kegels and why it may be the missing piece in your journey toward confidence and control. Now that you understand the power of Kegel exercises, let's explore how yoga fits into this picture. You may think of yoga as just stretching or relaxation, but in truth, it is one of the most complete systems for strengthening your entire body, including your pelvic floor. Yoga works in a unique way. It doesn't just target one set of muscles, it coordinates breath, posture, and awareness. This makes it especially effective for supporting bladder control and reducing incontinence. When you perform certain yoga poses, such as bridge pose or chair pose, your pelvic muscles are engaged naturally along with your core and hip muscles. This integrated strengthening helps keep your hammock stable. Research published in the journal Female Pelvic Medicine and Reconstructive Surgery has shown that women who practiced yoga regularly reported fewer leaks and greater confidence compared to those who did not. What's beautiful about yoga is that it isn't just about physical strength, it's also about mindfulness and calming the nervous system, which can reduce the sudden urges that often accompany incontinence. I once worked with a woman named Janet in her late 50s who told me she always mapped out every bathroom before leaving home. She started attending a gentle yoga class twice a week. After just 2 months, she noticed not only fewer leaks, but also less anxiety about leaving the house. She explained that yoga gave her a sense of control over both body and mind. That dual benefit, physical and emotional, is something I see again and again in women who embrace yoga as part of their wellness routine. So how exactly does yoga protect you from incontinence? One way is through the breath. In yoga, breathing isn't just inhaling and exhaling, it's coordinated with movement. Deep, diaphragmatic breathing strengthens the connection between your core and pelvic floor. Think of it like tuning a musical instrument. When all the parts are in harmony, the system works beautifully. This harmony reduces unnecessary pressure on the bladder and improves endurance of the pelvic muscles. Another key element is flexibility. As we age, our joints and connective tissue stiffen. Stiffness in the hips, back, and pelvis can make the bladder and pelvic floor work harder than they should. Yoga gently restores flexibility, creating space for your organs and reducing stress on your bladder. When the surrounding muscles and joints move with ease, the pelvic floor doesn't have to carry the whole burden by itself. There's also an emotional side we cannot ignore. Many women with incontinence feel ashamed or disconnected from their bodies. Yoga provides a safe, nurturing space to reconnect. Through gentle poses and mindful breathing, you're reminded that your body is not failing you, it simply needs care like any other part of you. This compassionate approach reduces the frustration and restores trust in your own strength. By blending the muscle-specific training of Kegels with the holistic body-mind benefits of yoga, you're not just addressing symptoms, you're building a foundation of lifelong resilience. And the best part, you don't need fancy equipment, a gym membership, or hours of free time. A few minutes each day, done consistently, can create powerful changes. In the next section, we'll dive deeper into how to combine Kegel exercises with yoga routines in practical, everyday ways that truly fit your lifestyle. Now that we've explored the benefits of yoga and Kegels individually, let's talk about how you can blend them together into your daily life. The beauty of these practices is that they are simple, discreet, and adaptable. You don't need a studio or special equipment, you just need consistency and a bit of patience with yourself. Think of it as creating a routine, much like brushing your teeth. Small daily habits can lead to powerful long-term protection against incontinence. A good starting point is to pair your Kegel practice with a gentle yoga routine. For example, when you begin your morning with a few minutes of deep breathing and stretching, you can add 3 sets of Kegel contractions. Hold each contraction for 5 seconds, then release for 5 seconds. Over time, as your strength grows, you can increase to 10-second holds. Doing this while lying in bridge pose or child's pose can make the practice feel more natural, because these positions support your body and allow you to focus on the pelvic floor without distraction. One of my patients, Linda, a 58-year-old retired teacher, created a morning ritual she calls her 10-minute reset. She spends 5 minutes in gentle yoga stretches, followed by 5 minutes of Kegels. At first, she wasn't sure it would make a difference. But after 6 weeks, she noticed fewer nighttime trips to the bathroom and more confidence during her daily walks. That simple commitment gave her back a sense of freedom she thought she had lost. Another way to blend yoga and Kegels is to use your breath as the anchor. Inhale deeply, and as you exhale, contract your pelvic floor. Then release on the next inhale. This rhythm not only strengthens your muscles, but also calms your nervous system. If you've ever felt that sudden, urgent need to rush to the bathroom, you know how stressful it can be. Coordinating Kegels with deep breathing trains your body to stay calm and controlled in those moments. Don't worry if you miss a day or if you forget a few times. What matters is the pattern over weeks and months, not perfection every single day. Think of it like watering a plant. You don't need to flood it, just keep it nourished steadily. Incontinence protection is very similar. Small, regular care leads to steady growth in strength and confidence. It's also important to listen to your body. If you ever feel pain or discomfort, ease off and adjust. The goal is gentle strengthening, not strain. And if you're unsure whether you're doing the exercises correctly, consider seeing a pelvic floor physical therapist. Many women find that just a session or two gives them the confidence to practice at home safely and effectively. By weaving yoga and Kegels into the fabric of your day, you're giving your body both the strength and the calm it needs to protect against incontinence. In the next section, we'll take a step back and reflect on why these practices matter, not just for bladder control, but for your overall health mobility and sense of well-being as you age. As we step back and reflect, it's clear that Kegels and yoga aren't just about preventing leaks. They represent something deeper, an investment in your overall health mobility and quality of life. Think about it. Your pelvic floor is connected to your posture, your balance, even your ability to enjoy daily activities like walking, gardening, or dancing. By caring for these muscles, you're not only protecting your bladder, you're supporting the very foundation of your independence. Many women tell me that incontinence makes them feel older than they are. They avoid social events, long trips, or even exercise classes out of fear. But strengthening your pelvic floor with Kegels and restoring harmony with yoga can lift that burden. It's like fixing a leaky roof. Before the rainy season, you restore confidence, knowing that you can rely on your body when life surprises you. I remember a woman named Carol, age 65, who described her incontinence as a secret shadow that followed her everywhere. After incorporating both yoga and Kegels into her routine, she told me the shadow had finally lifted. "I feel like I got a piece of myself back," she said. Her story is a reminder that these practices are not just physical, they touch your emotional and social well-being too. There's also an important connection to your long-term health. The American Heart Association emphasizes regular movement, including yoga, as a way to keep your heart and circulation strong. The Mayo Clinic highlights pelvic floor exercises as essential for maintaining bladder control after menopause. By combining the two, you're creating a holistic strategy for healthy aging that supports not only continence, but also bone strength, flexibility, and mental calm. At this point, I'd invite you to pause and reflect on your own life. Have you noticed times when incontinence has held you back? Maybe you hesitated to join friends on a trip, or maybe you've chosen your seat in a restaurant based on how close it was to the restroom. If so, know that you're not alone. Many women carry these unspoken worries, but also know this: your body is capable of change, and small, consistent actions can truly transform your daily experience. If you feel comfortable, share your reflections in the comments. Sometimes just knowing that others face the same struggles can be healing, and your story may be the encouragement another woman needs to begin her own journey. As we move into the final section, I'll share the last key insight about how Kegels and yoga create lasting protection, and we'll bring everything together into a warm, hopeful close. As we arrive at this final part, let's bring everything together. We've talked about the power of Kegels, the support of yoga, and the ways these two practices can blend seamlessly into your daily life. Now the last piece is consistency, the steady, gentle commitment that turns small efforts into lasting protection. Think of it like tending a garden. A little water each day keeps the flowers blooming, and in the same way, a few minutes of mindful movement each day keeps your pelvic floor strong and your confidence steady. One of the most hopeful truths I can share with you is this: improvement is possible at any age. Whether you're 50, 60, or 80, your muscles can still respond, strengthen, and adapt. The National Institute on Aging reminds us that regular activity helps preserve muscle health well into our later years. That means it's never too late to start. Even if you've been struggling with incontinence for years, your body still has the remarkable ability to heal and improve with practice. I've seen this firsthand with women who thought their situation was hopeless. One of my patients, Evelyn, age 72, told me she felt embarrassed even talking about her bladder leaks. With encouragement, she began a gentle yoga routine combined with Kegels. 6 months later, she smiled as she described going to her granddaughter's recital and sitting through the entire performance without worry. These are the victories that remind us why caring for ourselves matters so deeply. Beyond bladder control, these practices carry ripple effects across your life. Stronger pelvic muscles mean better posture and balance, which lowers your risk of falls. Calmer breathing and yoga practice ease stress, which benefits your heart and sleep. And most importantly, you gain back a sense of dignity and freedom, the ability to live your life without the constant worry of accidents. So as you think back on what we've covered today, remember Kegels are your strength training. Yoga is your harmony, and together they create a shield of protection for your future. You don't need perfection, just persistence. Start small, stay steady, and trust that every effort you make is an investment in your health and independence. I hope this conversation has given you both knowledge and encouragement. If you've found value here, I'd love for you to share your own experiences in the comments. Your voice matters, and your story may inspire another woman to begin. And if you'd like to continue learning with me, please consider subscribing and sharing this video with someone you care about. Together, we can build a community of women supporting women growing stronger with each step. Thank you for spending this time with me. I'm Dr. Lisa Perriera, and I look forward to guiding you on your journey to health, strength, and confidence.